options of egg freezing? Only way is by the IVF centers. You go there. So when you go to the IVF center, you talk about it. We first do your routine evaluation. What is your AMH? How is the quality of the eggs which you are having? What is your age? What are the rest of the hormone profile and everything? Then we stimulate you. Remember this, nothing is going to be so simple because we cannot take just one egg and freeze it. At the end of the procedure, when there is thawing and this egg goes wrong, then you don't have any frozen eggs left. So we stimulate you by giving you lots of hormonal stimulation, that is in the form of the injections, where you start developing around 10, 12 eggs. Of that, around 14th, 15th day of your cycle under anesthesia, we take out, aspirate the oocytes. We have a follicle doesn't mean there is an egg inside. So we need to examine under the microscope to see that the oocyte is there and it is of good quality. So we look at it and the good oocytes are then taken, maybe 7 or 8, and then they are frozen and kept it for how many years you want, maybe 5 years, 10 years, you can always freeze it for increased number of times and keep it like that. So whenever you find your partner, that's when the embryos are made, and then the embryo is inserted back into your uterus and you can carry the baby for 9 months. So at a time, in one cycle, we are going to aspirate somewhere around 7 to 10 oocytes and then they are frozen. So these are done in an in vitro fertilization technique by IVF technique in IVF centers. The best, like we always say, is a mother being less than 30 years. But is it possible in today's time? Because they are still not very clear they are going to freeze or they are going to find, because that is the age of hope. We hope to find somebody whom we want. That is the age when we think nothing can go wrong with us. We are immune to everything. Everything will go fine. So I think 30 would be ideal if they are very clear in their mind that definitely I am not going to have a child till 38 or 40 or whatever. But otherwise, I think less than 35 would be a better age to go ahead, just freeze your eggs if you are still uncertain of when to have a child. If you want to have a child and you are clear, just have it. Eggs mixing up with others, sperms mixing up with others, these are some things which people always have this distrust. Today's are the time where we are having the distrust between the doctor and the patient. The bond called trust has been broken, either because of some incidents what has happened on either sides. But again, saying that there is something called genetic material, there is something called DNA testing. You can always get the DNA testing of your, if you have frozen around 7, 8 eggs and you know this is the lot, and out of that one egg you can utilize to test and check with your DNA to confirm it is your DNA.